Iris chaffing can occur during phacoemulsification. So this is one patient who had a slightly atonic pupil, and as we can see the photo with mydriatics instilled, the pupil is still not very well dilated. This is the fundus photograph, which is unremarkable, and this was an elderly male individual. And here also we can see during the surgery the pupil is slightly dilated. Now iris trauma can occur during the surgery due to various reasons, and one of them can be trauma by the instruments. Especially during the phacoemulsification, the iris tissue may be aspirated into the phaco port, or there may be aspiration of the iris tissue along with the ultrasound energy being used at that moment, and this will cause disintegration of the tissue, loss of pigmentation, and also appearance of iris in form of a fibrillar tissue. So the stroma is exposed. So here we have a situation where this gentleman who was being operated for cataract and having a slightly atonic pupil, thus having inadequate mydriasis, was being operated upon. Although usually this is not an issue for me, but just in a nick of a second, what happened was that when I was very close to the iris and pupillary border, the assistant spurted fluid on the cornea just to keep it moist. And at the same moment, because of poor visibility and some manipulation, I caught the iris tissue. And because phaco power was on, and we can see that happening here, and we'll see that in slow motion, and I had to release the iris, but by that time the ultrasound power had been delivered and the iris tissue became traumatized. Now this kind of iris tissue, once it is traumatized, it starts getting phaco probe again and again, which you can see again in this slow motion video, and this will be a issue progressively, more so if the iris tissue is damaged too much at the sphincter part, then pupil may go into a mydriasis state, which may be a cause later on for some amount of glare. You can see the iris is being caught again and again because the pupil is getting smaller, and phacoemulsification requires fluid movement, which can cause surge, and the flow of fluid itself can draw the iris into the phaco tip. However, so we can see multiple times the iris tissue has been caught into the phaco tip, and as a result the iris tissue in that area has lost some pigment. The phacoemulsification has been done, and now the cortex which is remaining there is being removed. And the concern can also be because the patient was planned for a multifocal IOL, which requires certain amount of pupillary functions for adequate performance. So the IOL is being implanted now and the surgery is finished. However, we can see that there is some amount of iris tissue which has been damaged at 6 o'clock position, very close to the pupil sphincter, and next day we'll see that what is the amount of damage which is visible in form of inadequate pupillary functions or discoloration. And here we can observe that there is only minimal damage which is visible here, and the sphincter integrity is still maintained. However, this was a stint which was not desirable and could have been avoided with use of maybe some kind of pupillary expansion device, but then the question remains whether that would have caused permanent mydriasis or not. Thank you.